Nipah virus is one of the most dangerous viruses known to affect humans. It does not spread widely like common flu viruses, but when it does appear, it leaves behind fear, urgency, and a high number of fatalities. This is why every time Nipah virus is detected, it becomes a major topic of discussion among health authorities and the public alike. Nipah virus is a zoonotic virus, which means it spreads from animals to humans. It was first identified in the late 1990s during an outbreak among pig farmers. Since then, sporadic outbreaks have occurred in parts of South and Southeast Asia. What makes this virus especially concerning is not how often it appears, but how deadly and unpredictable it is. The natural carriers of the Nipah virus are fruit bats, commonly known as flying foxes. These bats do not fall ill themselves, but they carry and shed the virus through their saliva, urine, and feces. Humans become infected when they consume fruits or raw palm sap contaminated by bats, or when they come into close contact with infected animals. In some outbreaks, the virus has also spread from person to person, particularly among family members and healthcare workers. The illness often begins in a deceptively mild way. Early symptoms include fever, headache, muscle pain, vomiting, and sore throat, symptoms that closely resemble many common viral infections. Because of this, early diagnosis is difficult and valuable time can be lost. As the disease progresses, the virus attacks the central nervous system. Patients may develop encephalitis, an inflammation of the brain that causes confusion, drowsiness, seizures, and loss of consciousness. In severe cases, patients slip into a coma within a matter of days. Some patients also develop acute respiratory distress, which increases the risk of transmitting the virus to others. One of the most alarming aspects of Nipah virus is its fatality rate. Depending on the outbreak, between 40 and 75% of infected individuals have died. Even among survivors, long-term complications are common. Some people experience persistent neurological problems, while others may suffer from relapse of symptoms months or even years later. So, why is Nipah virus being talked about again? The answer lies in changing human behavior and environmental conditions. Rapid urbanization, deforestation, and climate change have significantly altered natural ecosystems. As forests shrink, bats are forced to live closer to human settlements. This increases the likelihood of viruses spilling over from wildlife into human populations. Another reason for global concern is the absence of a specific cure. There is currently no approved antiviral drug or vaccine for Nipah virus. Treatment is supportive, focusing on managing symptoms, providing oxygen, and preventing complications. This makes prevention and early containment the only effective strategies available. Whenever a suspected case is detected, public health authorities act immediately. Patients are isolated, contacts are traced, and hospitals implement strict infection control measures. These rapid responses are necessary because Nipah virus is classified as a high priority pathogen with the potential to cause serious outbreaks if not contained quickly. Simple preventive steps play a crucial role. Avoiding partially eaten fruits, not consuming raw palm sap, practicing good hygiene, and ensuring strict hospital safety protocols can significantly reduce the risk of transmission. Public awareness is one of the most powerful tools in stopping the spread before it escalates. Globally, Nipah virus is closely monitored because it serves as a warning. It highlights how closely human health is linked to animal health and environmental balance. A virus that circulates quietly in nature can suddenly emerge and challenge even the most advanced healthcare systems. In conclusion, Nipah virus is in the spotlight not because it is widespread, but because it is deadly, fast moving, and unforgiving. Each outbreak reminds us that preparedness, early detection, scientific vigilance, and responsible human behavior are essential to prevent a local health threat from becoming a larger crisis. Awareness does not create panic, awareness creates protection.